Hi, I'm Dr. Dwight Damon, inventor of the Damon system. I just would like to share some thoughts with you about why I got involved with all this. I think all of our passion is to do the best we possibly can for our patients. Clear back in 1985, I could see things going on in my patients that I just felt there was a better way. And so I started spending my time thinking about it. But what was a magical moment in the early 90s, when I took tubes, cut them in little pieces like brackets and glued them to teeth, and then put a little light wire, and I was astonished what happened. And I said, I just have to invent a bracket that will make all this happen. Over a period of time, we've figured out things that you can do that is a massive benefit to the patient without putting heavy forces on. But it's not just about forces. It's about long-term quality of care for the patient.
I love using the system because of how it works more naturally with our body. Using those lower forces that our body responds to in a more positive manner, that's why I started using it. And when I talk to my patients about this, it makes sense to them. Patients nowadays, they're looking for things that are more healthy, more natural.
It is more than straight teeth. It's about a functional occlusion that's healthy for the long term. It's creating smiles for a lifetime. And these results that allow these patients to express their inner confidence. When they walk into a room, they're proud of how they look. And that just feels good to see that transformation.
One of the things that I love the most about it is the simple treatment protocols. From the very beginning, ideal bracket placement, what we have is a system that allows us to help teach our clinical technicians to provide comprehensive and progressive care that is thoughtful and progressive, that provides meaningful changes to the patient at each appointment, creates a beautiful end result. It gives you a framework to do awesome work.
I continue to be amazed at the progress that our patients make, how efficient things look. But you know what? What's more important? Our parents and our patients recognize it as well. They come in all the time saying they can't believe the changes that they're experiencing.
It's very simplified mechanics. Although it's not a cookbook, it does provide a sequence of wires that we use. It's you're able to standardize that in your practice. It makes it easier to treat patients. It makes it easier on your clinical staff because they're used to a very standardized and methodical way to do things.
The improved efficiency and the increased profitability is reason enough to consider the transition. That combined with the level of results that you can predictably achieve, I can't imagine ever going back to treating with the traditional bracket system.
With the Damon system, I obviously can move teeth and bone in ways that I never could before. We're taking very crowded cases, we're treating with non-extraction, we're treating many cases without palatal expanders, we're getting tremendous posterior arch adaptation. In short, I'm doing things that I could have never done before with fixed appliances. And it made me a better orthodontist. I was able to do things that I couldn't do before. It allowed me to do things for my patients that I could not do before. So it obviously enhanced my practice.
Interesting to see what's happened to the patients of mine in the community. Patients are referring other patients and saying, oh, you have to go see Dr. Frost. His smiles are amazing. And it's not that I do anything different than anybody else. It's just that I use the Damon system the way it was intended to be used. And I pay attention to my results. So I've realized in 15 years of practice with the Damon system, it's more than just straight teeth. It's about creating beautiful smiles, spectacular, awesome smiles.
What I find so unique about the Damon system is it has finally given our profession the opportunity to practice orthodontics as we know it should be practiced. Now that's an easy thing to say, but we all know that the driving motivational aspect for us is to deliver great faces and great smiles.
We all need to get better each and every day. we just can't ever say to ourselves, that's good enough. Together, collectively, utilizing great technology, we all need to go to a whole nother level. How fun is that? I thank you all for being a part of creating what we can do for our patients. Thank you.